Ebola virus disease EVD is an communicable disease Look at this picture, shows that Ebola virus in spots and Ebola virus disease outbreaks. Look at this. Detail going on. Introduction. Ebola virus disease is a severe, often fatal illness in humans and non-human primates caused by infection with one of the Ebola virus species. First identified in 1976 in outbreaks near the Ebola River in what is now the Democratic Republic of Congo. EVD has become notorious for its high mortality rates. Capacity to spread rapidly, particularly in areas with weak healthcare infrastructure. Outbreaks have occurred sporadically since, with the most widespread epidemic occurring between 2014 and 2016 in West Africa. Definition: EVD is a viral hemorrhagic fever that causes multi-system involvement leading to severe bleeding, organ failure and high mortality rates, often ranging from 25% to 90%. The virus belongs to the family Filoviridae and the genus Ebola virus. Types: there are 6 known species of the Ebola virus, each with varying levels of pathogenicity. 1. ZR Ebola virus, the most deadly and responsible for the largest outbreaks. 2. Sudan Ebola virus, also highly lethal but with a slightly lower mortality rate. 3. Bundi Bugyo Ebola virus, identified in Uganda with lower fatality rate than ZR and Sudan strains. 4. Thai forest Ebola virus, a rare species causing only one known case. 5. Ruston Ebola virus, primarily affects non-human primates, has not caused human illness. 6. Bomboli Ebola virus. Recently discovered and not yet known to cause disease in humans. Causes. EVD is caused by infection with one of the Ebola virus species. The virus primarily resides in wild animals, with humans becoming infected through contact with bodily fluids or tissues of infected animals, or through person to person transmission. Transmission. EVD is primarily transmitted through 1. Direct contact with blood, secretions or other bodily fluids, saliva, urine, feces, vomit of an infected person, particularly in later stages of illness or after death. 2. Indirect contact with contaminated objects such as needles, bedding, clothing. 3. Animal to human transmission occurs through contact with infected animals, bats. 4. Human to human transmission happens most frequently during care of infected patients or burial practices. 5. The virus can also persist in body fluids of the survivors, leading to possible transmission for months after recovery. Risk factors. 1. Close contact with infected individuals or animals. 2. Handling or consuming basmat from wild animals, especially in affected regions. 3. Healthcare workers without adequate protective measures. 4. Participation in burial rituals that involves direct contact with body of the deceased. 5. Living or traveling in areas where outbreaks have occurred, particularly in rural Africa. Complications. EVD can lead to several severe complications, including 1. Severe bleeding, internal and external, which may lead to shock and multi-organ failure. 2. Septic shock, a result of overwhelming infection. 3. Neurological issues such as confusion, delirium and seizures. 4. Post-Ebola syndrome, which include lingering symptoms such as joint pain, fatigue, vision problems and memory issues in survivors. 5. Death, particularly if intensive care and supported treatments are unavailable. Pathophysiology. The Ebola virus targets endothelial cells, macrophages, dendritic cells, and monocytes. After entering the body, typically through mucous membranes, skin breaks, or parenteral roots, the virus replicates rapidly. Avoiding the immunoresponse, it triggers a massive pro-inflammatory response, leading to vascular injury and increased permeability. This results in a widespread systemic inflammatory response, septic shock, hemorrhagic manifestations, and multi-organ dysfunction. The pathophysiology of Ebola virus disease involves several complex steps. From the moments the virus enters the body until it causes severe systemic damage. Here is a step-by-step breakdown of the process. 1. Entry into body, portal of entry, initial targets. 2. Viral replication in immunocells, attachment and entry, replication, cellular destruction. 3. Immunoevasion, suppression of immunoresponse, inhibit interferon production, dendritic cell dysfunction. 4. Dissemination throughout the body, spread via lymph and blood, liver cells, hepatocytes, endothelial cells, lining blood vessels, other immunocells like neutrophils and natural killer cells, systemic viremia. 5. Widespread inflammation and systemic storm. Cytokine release, cytokine storm, increased vascular permeability. 6. Coagulation dysfunction and hemorrhage, disseminated intravascular coagulation, DIC, hemorrhage. 7. Organ failure, multi-organ dysfunction, liver failure, kidney failure, adrenal failure. 8. Hypovolemic shock and death. Septic shock. The disease progresses rapidly, with patients usually showing severe symptoms within a few days after the onset of illness. The high mortality rate is largely due to the body's inability to contain the virus and the profound dysregulation it causes. Signs and symptoms. EVD has an incubation period of 2 to 21 days. Early symptoms resemble flu-like illness and include 1. Sudden onset of fever, 2. Severe headache, 3. Muscle pain and weakness, 4. Fatigue, 5. Sore throat. As the disease progresses, more severe symptoms appear. 1. Vomiting and diarrhea, 2. Abdominal pain, 3. Unexplained bleeding or bruising, hemorrhaging, 4. Chest pain and shortness of breath, 5. Rash, 6. Confusion or seizures. Diagnosis. Diagnosing EVD is challenging due to its non-specific early symptoms. Key diagnostic tools include 1. PCR. Polymerase chain reaction detects viral RNA in blood samples. 2. ELISA. Enzymes linked immunosorbent assay. Detect antigens or antibodies against the virus. 3. Virus isolation. Grow in culture for identification, rarely done due to biosafety risk. 4. Serological test, usually in confirming infection during later stages or after recovery. Nursing diagnosis. Nursing diagnosis for patients with EVD may include 1. Risk for infection related to exposure to contaminated materials. 2. Impaired gas exchange related to respiratory failure or hypoxia. 3. Deficient fluid volume related to excessive vomiting, diarrhea and bleeding. 4. Acute pain due to muscle and joint pain. 5. Risk for shock related to hemorrhage or septic shock. 6. Anxiety related to fear of disease, isolation. Management. 1. Isolation. Strict isolation is essential to prevent transmission. 2. Supportive care includes rehydration through oral or intravenous fluids, maintaining oxygenation and treating secondary infections or organ failure. 3. Monitoring. Continuous monitoring of vital signs, fluid balance and organ function. 4. Psychological support. Important due to high levels of stress, anxiety and fear in both patients and caregivers. Treatment. There is no specific cure for Ebola, but several treatments have shown promise. 1. Monoclonal antibodies. Drugs like Inmazib and Abanco are now approved for treating EVD. By neutralizing the virus. 2. Antiviral agents. Remdesivir has been used experimentally. 3. Supportive therapies including fluid resuscitation, oxygen therapy, and correction of electrolytes imbalances. Psychosocial medicine. Patients with EVD often experience stigma, isolation, and significant psychological stress. Counseling and mental health support and reintegration into communities are critical components of care. Survivors may suffer from post-Ebola syndrome, including depression and anxiety. Prevention. Preventive measures focus on limiting transmission. 1. Vaccination. Vaccine has been effective during outbreaks. 2. Personal protective equipments PPE. Healthcare workers must use PPE to prevent exposure. 3. Infection control practices including hand hygiene, sterilization, and safe burial practices. 4. Avoiding bushment, reducing contact with potential animal reservoirs. 5. Travel advices and monitoring for areas where outbreaks are ongoing. In conclusion, Ebola virus disease is a severe and often deadly illness requiring prompt isolation, supportive care, and strict infection control measures. Advances in treatment such as monoclonal antibodies and vaccines have significantly improved the prognosis for affected individuals. However, preventing outbreaks and providing adequate psychological support remains a challenge in resource limited settings. Thank you. Have a nice day.